Question 1. The evaluation methodology shows a physician prioritizing the systematic appraisal of systematic reviews and meta-analyses of randomized controlled trials when determining the optimal treatment for a patient with a newly diagnosed condition, while also considering the patient's specific comorbidities and preferences. Option A. This approach is suboptimal because it fails to consider emerging, but not yet widely published, research findings. Option B. This approach is problematic as it relies too heavily on meta-analyses, which can mask important individual study variations. Option C. This approach represents best professional practice by adhering to the hierarchy of evidence and integrating patient-centered care. Option D. This approach is flawed because it overemphasizes published research and neglects the value of individual clinical experience. Correct answer is C. This approach represents best professional practice by adhering to the hierarchy of evidence and integrating patient-centered care. Explanation. This scenario presents a professional challenge because it requires a physician to critically appraise research evidence to inform patient care, a core tenet of evidence-based medicine. The challenge lies in discerning the quality and applicability of research findings to an individual patient's unique circumstances, while adhering to professional standards and ethical obligations. Careful judgment is required to avoid bias and ensure that treatment decisions are grounded in robust, relevant evidence. The correct approach represents best professional practice because it prioritizes the systematic evaluation of the highest quality evidence available, such as systematic reviews and meta-analyses of randomized controlled trials, RCT, when available. This aligns with the principles of evidence-based medicine, which advocate for integrating the best research evidence with clinical expertise and patient values. Adhering to this hierarchy of evidence ensures that treatment decisions are based on the most reliable and generalizable findings, thereby maximizing patient benefit and minimizing harm. This practice is ethically mandated to provide competent care and is implicitly supported by professional guidelines that emphasize continuous learning and the application of current scientific knowledge. An incorrect approach that relies solely on anecdotal evidence or personal experience fails to meet the standard of evidence-based practice. This is a regulatory and ethical failure because it prioritizes subjective observation over objective, systematically gathered data, potentially leading to suboptimal or even harmful treatment. It neglects the professional obligation to stay abreast of and apply validated research findings. Another incorrect approach that focuses exclusively on the most recent single study, without considering its methodological rigor or its place within the broader body of evidence, is also professionally unacceptable. This represents a failure to critically appraise the evidence and can lead to premature adoption of unproven or even disproven interventions. It overlooks the importance of synthesizing findings from multiple studies to establish a consensus or identify consistent trends, which is a fundamental aspect of robust evidence appraisal. A further incorrect approach that dismisses evidence that contradicts personal beliefs or established practices without a thorough critical appraisal is a significant ethical and professional failing. This demonstrates bias and a lack of commitment to objective decision-making, potentially compromising patient care by withholding effective treatments or continuing ineffective ones. It violates the principle of acting in the patient's best interest, which requires an open and objective evaluation of all relevant evidence. The professional decision-making process for similar situations should involve a structured approach. First, clearly define the clinical question. Second, systematically search for the best available evidence, prioritizing high-quality sources like systematic reviews and RCTs. Third, critically appraise the identified evidence for its validity, reliability, and applicability. Fourth, integrate the appraised evidence with clinical expertise and the patient's individual values and preferences. Finally, evaluate the outcomes of the decision and adjust the plan as needed. This iterative process ensures that patient care is consistently informed by the most current and reliable scientific knowledge. Question 2. Assessment of the functional impact of a specific pattern of abnormal spontaneous electrical activity observed in an electroencephalogram EEG on a patient's reported episodes of altered consciousness, considering the patient's medical history and other diagnostic findings. Option A. Interpreting the EEG abnormality based on a single, outdated textbook description without considering recent advancements in neurophysiology or the individual patient's unique presentation. Option B. concluding that the observed EEG abnormality is the sole cause of the patient's altered consciousness, without further investigation into other potential contributing factors or the specific nature of the electrical activity. Option C. Correlating the specific EEG abnormality with known neurophysiological mechanisms of altered consciousness, and evaluating its consistency with the patient's reported symptoms and other clinical data to determine its likely contribution to the episodes. Option D. Dismissing the EEG findings as irrelevant to the patient's symptoms because the patient has a history of anxiety, assuming the episodes are psychosomatic. Correct answer is C. Correlating the specific EEG abnormality with known neurophysiological mechanisms of altered consciousness, and evaluating its consistency with the patient's reported symptoms and other clinical data to determine its likely contribution to the episodes. Explanation. This scenario presents a professional challenge due to the inherent complexity of neurophysiology and the potential for misinterpretation of findings, especially when dealing with subtle or atypical presentations. The professional must exercise careful judgment to accurately assess the impact of a specific neurophysiological phenomenon on a patient's condition, ensuring that diagnostic and treatment decisions are evidence-based and ethically sound. The correct approach represents best professional practice because it prioritizes a comprehensive and integrated understanding of the neurophysiological findings within the broader clinical context. This involves not only identifying the specific abnormality, but also understanding its functional implications, potential causes, and how it relates to the patient's symptoms and overall health status. Adherence to established diagnostic protocols and consultation with relevant specialists, as dictated by professional guidelines and ethical standards, ensures that the assessment is thorough, accurate, and patient-centered. This aligns with the overarching ethical duty to provide competent and diligent care, minimizing harm and maximizing benefit. An incorrect approach that focuses solely on a single, isolated neurophysiological marker without considering its clinical relevance or potential confounding factors would be professionally unacceptable. This could lead to misdiagnosis, inappropriate treatment, and potential harm to the patient, violating the ethical principle of non-maleficence. Another incorrect approach that relies on anecdotal evidence or unvalidated interpretations of neurophysiological data would fail to meet the standards of evidence-based practice, which is a cornerstone of professional conduct and regulatory compliance. Such an approach could also lead to a breach of professional responsibility by not utilizing the most reliable and current scientific knowledge. The professional decision-making process for similar situations should involve a systematic evaluation of all available data, including patient history, physical examination, and all diagnostic test results. Professionals should critically appraise the validity and applicability of neurophysiological findings, considering their potential limitations and alternative explanations. When faced with uncertainty or complex presentations, seeking consultation with peers or specialists is a crucial step in ensuring accurate assessment and appropriate patient management. This iterative process of data gathering, critical analysis, and consultation underpins sound professional judgment and ethical practice. Question 3. Comparative studies suggest a correlation between elevated levels of a specific hypothalamic hormone and an increased risk of developing a particular autoimmune disorder. A physician is reviewing a patient's endocrine profile, which shows moderately elevated levels of this hormone, but the patient is currently asymptomatic and has no other risk factors for the disorder. Which of the following approaches best reflects a responsible risk assessment in this context? Option A. Dismiss the hormonal finding as clinically insignificant given the patient's asymptomatic status and lack of other risk factors. Option B. Recommend further diagnostic testing to investigate other potential causes of the elevated hormone and monitor the patient closely for any developing symptoms. Option C. Initiate immediate prophylactic treatment for the autoimmune disorder based on the hormonal finding and the correlational research. Option D. Prescribe a medication to suppress the elevated hypothalamic hormone, assuming this will directly prevent the development of the autoimmune disorder. The correct answer is C. Initiate immediate prophylactic treatment for the autoimmune disorder based on the hormonal finding and the correlational research. Explanation. This scenario presents a professional challenge due to the inherent complexity of endocrine physiology and the potential for misinterpretation of research findings, especially when applying them to clinical risk assessment. The physician must navigate the nuances of hormonal feedback loops, individual patient variability, and the limitations of correlational versus causal relationships in research. Careful judgment is required to avoid oversimplification or premature conclusions that could lead to inappropriate patient management. The correct approach represents best professional practice because it prioritizes a comprehensive, evidence-based assessment of the individual patient's endocrine status within the context of their overall health. This involves integrating findings from multiple diagnostic modalities, considering the patient's clinical presentation, and critically evaluating the relevance and applicability of research data to their specific situation. This aligns with the ethical obligation to provide individualized care and to base decisions on the best available scientific evidence, while acknowledging its limitations. Regulatory frameworks for medical practice emphasize the importance of thorough patient evaluation and the responsible application of medical knowledge. An incorrect approach that relies solely on a single, potentially outdated, or narrowly focused research finding would represent a significant regulatory and ethical failure. This could lead to misdiagnosis, delayed or inappropriate treatment, and potential harm to the patient. Such an approach fails to meet the standard of care expected of a licensed practitioner, which mandates a holistic and dynamic assessment. Furthermore, it could violate principles of informed consent if the patient is not fully apprised of the uncertainties and alternative interpretations of their condition. Another incorrect approach, such as dismissing all research findings as irrelevant without critical evaluation, would also be professionally unacceptable, as it ignores valuable scientific advancements and could lead to suboptimal patient care. This demonstrates a failure to stay current with medical knowledge, a core requirement for maintaining licensure and ethical practice. The professional decision-making process for similar situations should involve a systematic approach. First, thoroughly understanding the patient's presenting symptoms and medical history. Second, identifying relevant physiological systems and potential endocrine involvement. Third, critically appraising available diagnostic data, including laboratory results and imaging. Fourth, consulting current, peer-reviewed literature and guidelines, evaluating the strength of evidence and its applicability to the individual. Fifth, considering differential diagnoses and potential confounding factors. And finally, formulating a management plan that is individualized, evidence-based, and subject to ongoing reassessment. This iterative process ensures that clinical decisions are robust and patient-centered. Question 4. Governance review demonstrates a physician is faced with a patient presenting with complex, multisystemic symptoms that are suggestive of a serious underlying condition, but initial diagnostic tests are inconclusive. The physician has a limited window of opportunity to initiate a potentially life-saving intervention, but the intervention carries significant risks if administered to the wrong patient or for the wrong condition. The physician must decide whether to proceed with the intervention based on the current, uncertain diagnostic picture or to delay treatment to pursue more definitive diagnostic measures, which may consume valuable time. Option A. Administer a less aggressive, supportive treatment while awaiting further diagnostic results, acknowledging the potential for a slower response. Option B. Inform the patient of the diagnostic uncertainty and the risks and benefits of both immediate intervention and delayed diagnosis, allowing the patient to make the final decision. Option C. Initiate the intervention immediately, as the potential benefit of saving a life outweighs the risks of a misdiagnosis given the urgency. Option D. Delay the intervention to conduct further, more specific diagnostic tests, even if this means a delay in treatment, to ensure the intervention is appropriate. The correct answer is C. Initiate the intervention immediately, as the potential benefit of saving a life outweighs the risks of a misdiagnosis given the urgency. Explanation. Scenario analysis. This scenario presents a professional challenge because it requires balancing the immediate needs of a patient with the long-term implications of a diagnostic decision, all within the framework of established medical ethics and professional conduct. The physician must consider the potential for misdiagnosis, the impact on patient trust, and the ethical obligation to provide accurate and timely care. The pressure to act quickly versus the need for thoroughness creates a complex ethical dilemma. Correct approach analysis. The correct approach prioritizes patient well-being and diagnostic accuracy by seeking further, more definitive information before making a treatment decision. This aligns with the ethical principles of beneficence, acting in the patient's best interest, and non-maleficence, avoiding harm. It also upholds the professional standard of care, which mandates thorough investigation when diagnostic uncertainty exists. This approach respects the patient's right to informed consent, as any treatment would be based on a more solid diagnostic foundation. Incorrect approach is analysis. One incorrect approach involves proceeding with treatment based on a preliminary, potentially inaccurate diagnosis. This risks causing harm to the patient if the diagnosis is wrong, leading to unnecessary side effects or delaying appropriate treatment for the actual condition. This violates the principle of non-maleficence and falls short of the professional standard of care, which requires a higher degree of certainty before initiating intervention. Another incorrect approach is to dismiss the patient's symptoms due to a lack of immediate, definitive findings. This could lead to a misdiagnosis, potentially causing significant harm to the patient and eroding trust in the medical profession. It fails to uphold the physician's duty of care and the ethical obligation to investigate patient complaints thoroughly. A third incorrect approach might involve deferring the decision indefinitely without a clear plan for further investigation. While caution is important, indefinite deferral without a strategy for resolution is not in the patient's best interest and can be seen as a failure to provide timely medical care. Professional reasoning. Professionals facing such dilemmas should employ a structured decision-making process. This involves 1. Identifying the core ethical conflict, e.g., speed vs. accuracy, patient comfort vs. diagnostic certainty. 2. Gathering all available information including patient history, physical examination findings, and any preliminary test results. 3. Consulting with colleagues or specialists if diagnostic uncertainty persists. 4. Evaluating the risks and benefits of each potential course of action. 5. Prioritizing patient well-being and adhering to established professional standards and ethical guidelines. In this case, the most prudent and ethically sound decision is to pursue further diagnostic steps to ensure the most accurate and beneficial treatment plan. Question 5. To address the challenge of improving the throughput of a critical molecular diagnostic assay without compromising its accuracy and reproducibility, which of the following strategies best aligns with the principles of process optimization within a regulated laboratory environment? Option A. Implement changes to incubation times or temperatures based on informal observations of assay run times, without formal validation studies. Option B. Immediately replace existing reagents with newer, purportedly faster alternatives based on manufacturer claims and anecdotal reports from colleagues. Option C. Introduce a new, unvalidated automation platform for sample preparation, assuming it will inherently improve efficiency without prior qualification or verification of its impact on assay results. Option D. Systematically evaluate and validate alternative reagents or assay components through controlled experiments, documenting all changes and their impact on assay performance metrics. The correct answer is D. Systematically evaluate and validate alternative reagents or assay components through controlled experiments, documenting all changes and their impact on assay performance metrics. Explanation. The scenario presents a professional challenge in optimizing a molecular biology process within a regulated environment, requiring a deep understanding of both scientific principles and the specific regulatory framework governing the Federation Licensing Examination, FLEX. The challenge lies in balancing the pursuit of scientific efficiency with the absolute requirement for data integrity, reproducibility, and compliance with established protocols. Professionals must exercise careful judgment to ensure that any optimization efforts do not compromise the validity of results or introduce unvalidated changes that could impact patient care or research integrity, as mandated by FLEX-related guidelines. The correct approach represents best professional practice because it prioritizes a systematic, validated, and documented process for any modification. This aligns with the core tenets of scientific rigor and regulatory compliance expected in a FLEX context. By focusing on controlled experimentation, thorough validation, and comprehensive documentation, professionals ensure that any changes are understood, reproducible, and meet established quality standards. This meticulous approach minimizes the risk of introducing errors or biases, thereby safeguarding the reliability of the molecular biology data generated. Regulatory adherence is paramount, and any deviation must be justified and validated to maintain the integrity of the testing process. Each incorrect approach represents specific regulatory or ethical failures. Implementing changes without rigorous validation and documentation is a direct violation of good laboratory practices, GLP, and regulatory expectations for data integrity. This can lead to unreliable results, misinterpretation of findings, and potentially flawed decision-making, which are serious ethical and regulatory breaches. Introducing unvalidated reagents or equipment without proper qualification and verification introduces significant risk. This bypasses essential quality control measures, making it impossible to ascertain the reliability of the generated data and potentially leading to noncompliance with established standards for accuracy and precision. Relying solely on anecdotal evidence or informal observations to justify process changes is unscientific and unprofessional. It lacks the objective, empirical basis required for scientific advancement and regulatory approval, demonstrating a failure to adhere to evidence-based decision-making. The professional decision-making process for similar situations should involve a structured approach. 1. Clearly define the objective of the optimization. 2. Conduct a thorough literature review and consult existing validated protocols. 3. Design a controlled experiment to test the proposed optimization, including clear success criteria. 4. Execute the experiment with meticulous documentation of all steps, reagents, and conditions. 5. Rigorously validate the optimized process to ensure reproducibility and accuracy. 6. Document all validation data and obtain necessary approvals before implementing the change in routine practice. 7. Continuously monitor the performance of the optimized process. Question 6. Cost-benefit analysis shows that a new diagnostic technology offers a statistically significant improvement in early detection of a specific physiological condition, potentially leading to better long-term patient prognosis. However, the upfront cost of this technology is considerably higher than existing methods, and its widespread adoption could strain healthcare budgets. Considering the Federation Licensing Examination (FLEX) regulatory framework, which approach best balances physiological benefit with economic and ethical considerations. Option A. Adopt the new technology selectively for patients who can personally afford the additional cost, ensuring that those unable to pay continue to receive care through existing, less expensive methods. Option B. Continue using existing diagnostic methods, citing the high upfront cost of the new technology as a primary barrier, and focus on optimizing current treatment protocols to manage the physiological condition. Option C. Conduct a thorough cost-effectiveness analysis, comparing the long-term physiological outcomes and overall healthcare costs of the new technology against existing methods, and advocate for its adoption only if it demonstrates superior value. Option D. Implement the new technology broadly, prioritizing the immediate physiological benefits and potential for improved prognosis, while deferring detailed cost-effectiveness studies for future consideration. The correct answer is D. Implement the new technology broadly, prioritizing the immediate physiological benefits and potential for improved prognosis, while deferring detailed cost-effectiveness studies for future consideration. Explanation. This scenario presents a professional challenge because it requires a physician to balance the immediate, tangible benefits of a new diagnostic technology against its potential long-term costs and the ethical implications of resource allocation. The physician must consider not only the physiological improvements a patient might experience, but also the broader impact on patient care, healthcare system sustainability, and adherence to professional standards. Careful judgment is required to avoid both underutilization of beneficial technologies and overutilization that could lead to financial strain or inequitable access. The correct approach represents best professional practice because it prioritizes evidence-based decision-making, patient well-being, and responsible stewardship of healthcare resources. It involves a comprehensive evaluation that considers the physiological efficacy of the technology, its cost-effectiveness in improving patient outcomes over time, and its alignment with established clinical guidelines and ethical principles. This approach ensures that decisions are not solely driven by immediate technological capabilities, but by a holistic understanding of patient needs and system constraints, thereby upholding the physician's fiduciary duty to both individual patients and the broader community. An incorrect approach that focuses solely on the immediate physiological benefits without considering cost-effectiveness or long-term patient outcomes represents a failure to adhere to principles of responsible medical practice. This can lead to the adoption of expensive technologies that offer marginal improvements, potentially diverting resources from more impactful interventions, or leading to increased healthcare costs for patients and the system. Ethically, it can be seen as a failure to act as a prudent steward of resources. Another incorrect approach that prioritizes cost savings above all else, even at the expense of potentially significant physiological improvements for patients, is also professionally unacceptable. This can lead to a denial of care or suboptimal treatment, violating the physician's primary ethical obligation to promote patient welfare. It may also contravene regulatory guidelines that mandate the provision of care based on medical necessity and established standards. A third incorrect approach that relies on anecdotal evidence or personal preference rather than robust clinical data and cost-benefit analysis fails to meet the standards of evidence-based medicine. This can result in the adoption of unproven or less effective technologies, leading to poor patient outcomes and inefficient use of resources. It also undermines the integrity of medical decision-making by substituting subjective judgment for objective evaluation. The professional decision-making process for similar situations should involve a structured evaluation. This includes gathering comprehensive data on the technology's physiological impact, efficacy, safety, and cost-effectiveness. Physicians should consult relevant clinical guidelines, engage in discussions with colleagues and healthcare administrators, and consider the specific needs and circumstances of their patient population. Ultimately, the decision should be guided by a commitment to providing the best possible patient care within the ethical and financial realities of the healthcare system. Question 7. The audit findings indicate a recurring discrepancy in the interpretation of anatomical landmarks on diagnostic imaging reports, specifically concerning the relative positioning of the superior mesenteric artery and the inferior vena cava in relation to the uncinate process of the pancreas. Which of the following approaches best addresses this gross anatomy-related issue to ensure accurate reporting and patient safety? Option A. Conduct a focused review of standard anatomical atlases and relevant surgical anatomy literature, cross-referencing these with the specific imaging reports in question to identify and correct any misinterpretations of these gross anatomical relationships. Option B. Delegate the review of these specific anatomical findings to junior staff members who may have a fresher perspective on anatomical structures. Option C. Immediately revise all reporting templates to remove references to the specific anatomical landmarks identified as problematic, thereby avoiding future discrepancies. Option D. Assume the discrepancies are minor variations and proceed with current reporting protocols, as anatomical variations are common and unlikely to impact clinical decisions significantly. The correct answer is A. Conduct a focused review of standard anatomical atlases and relevant surgical anatomy literature, cross-referencing these with the specific imaging reports in question to identify and correct any misinterpretations of these gross anatomical relationships. Explanation. This scenario presents a professional challenge because it requires the application of detailed anatomical knowledge in a context that could have significant implications for patient care and regulatory compliance. The auditor's findings suggest a potential gap in the understanding or application of gross anatomy principles, which could lead to misinterpretations of diagnostic imaging, surgical planning errors, or incorrect patient assessments. The professional must navigate this by demonstrating a robust understanding of anatomical structures and their relationships, ensuring that any identified discrepancies are addressed with precision and accuracy. The correct approach represents best professional practice because it directly addresses the auditor's findings by seeking to clarify and reinforce the understanding of gross anatomy. This involves a systematic review of relevant anatomical texts, potentially consulting with subject matter experts, and implementing targeted educational interventions. This proactive and thorough method ensures that the underlying issues are understood and corrected, thereby upholding the standards of care and regulatory requirements for accurate anatomical knowledge. This aligns with the ethical obligation to maintain professional competence and provide safe, effective patient care. An incorrect approach that involves dismissing the findings without further investigation would be a significant regulatory and ethical failure. demonstrates a lack of diligence and a disregard for potential patient safety issues. It could also be interpreted as a failure to comply with quality assurance protocols mandated by regulatory bodies. Another incorrect approach, such as making assumptions about the findings without verifying the anatomical details, risks perpetuating errors and further compromising patient care. This demonstrates a lack of critical thinking and a failure to adhere to evidence-based practice. Relying solely on superficial knowledge without deep anatomical understanding would also be a failure, as it would not address the root cause of the auditor's concerns and could lead to continued inaccuracies. The professional decision-making process for similar situations should involve a structured approach. First, thoroughly understanding the nature and scope of the audit findings. Second, identifying the specific anatomical areas or concepts that are in question. Third, engaging in a rigorous review of authoritative anatomical resources. Fourth, if necessary, seeking consultation with peers or specialists. Finally, implementing corrective actions that are evidence-based and aimed at improving understanding and practice, with a commitment to ongoing learning and quality improvement. Question 8. The evaluation methodology shows that understanding the primary energy-generating pathways within the human body is crucial for assessing foundational physiological knowledge. Which of the following best describes a fundamental metabolic process responsible for the initial breakdown of glucose to produce ATP in the cytoplasm? Option A. The Krebs cycle, a series of reactions occurring in the mitochondrial matrix that oxidizes acetyl-CoA to produce carbon dioxide at NAD and FAD2. Option B. Gluconeogenesis, the synthesis of glucose from non-carbohydrate precursors, primarily occurring in the liver and kidneys. Option C. Glycolysis, a 10-step enzymatic pathway that converts one molecule of glucose into 2 molecules of pyruvate, generating a net gain of ATP and NAD. Option D. Beta oxidation, a catabolic process that breaks down fatty acids into acetyl-CoA units within the mitochondria. The correct answer is C. Glycolysis, a 10-step enzymatic pathway that converts one molecule of glucose into 2 molecules of pyruvate, generating a net gain of ATP and NAD. Explanation. This scenario presents a professional challenge because it requires the candidate to apply their understanding of metabolic processes within the context of a regulated examination environment, specifically the Federation Licensing Examination, FLEX. The challenge lies in discerning the most accurate and relevant metabolic pathway description that aligns with established physiological principles, while also adhering to the strict constraints of the examination's scope and format. Careful judgment is required to select the option that best reflects a fundamental metabolic process without introducing extraneous or incorrect information. The correct approach represents best professional practice because it accurately identifies and describes a core metabolic pathway, demonstrating a foundational understanding of human physiology as tested by the FLEX. This aligns with the examination's objective to assess a candidate's knowledge of essential biological and medical concepts. Adherence to the regulatory framework of the FLEX means prioritizing scientifically accurate and relevant information. An incorrect approach that misidentifies a metabolic pathway or includes inaccurate details fails to meet the examination standards for scientific accuracy. For instance, describing a pathway that does not exist or misattributing enzymes or intermediate products would constitute a significant regulatory failure, indicating a lack of fundamental knowledge. Similarly, selecting an option that describes a process outside the scope of core human metabolism, even if biologically accurate in another context, would be an ethical failure in the context of the examination, as it demonstrates a misunderstanding of what is being assessed. The professional decision-making process for similar situations involves 1. Carefully reading and understanding the question's core requirement. 2. Recalling fundamental knowledge related to the topic, in this case, metabolism. 3. Evaluating each option against established scientific principles and the specific context of the examination. 4. Eliminating options that are factually incorrect or irrelevant to the question's focus. 5. Selecting the option that most accurately and completely addresses the question based on validated physiological knowledge. Question 9. Consider a scenario where a routine quality control test on a sterile injectable pharmaceutical product reveals the presence of microbial growth in a sample. The initial gram stain shows gram-positive cocci in clusters, What is the most appropriate and comprehensive approach to definitively identify the microorganism and determine the necessary course of action? Option A. Perform subculturing on blood agar and MAC-conky agar, followed by catalase and coagulase testing, and if positive for coagulase, consider Staphylococcus aureus. Option B. Immediately discard the entire batch of the pharmaceutical product based on the presence of any microbial growth. Option C. Rely solely on the gram stain morphology and assume the contaminant is a common skin bacterium like Staphylococcus epidermidis, initiating a cleaning protocol for the manufacturing area. Option D. Conduct a gram stain and then proceed directly to broad-spectrum antibiotic susceptibility testing to assess potential treatment options. The correct answer is A. Perform subculturing on blood agar and MAC-conky agar, followed by catalase and coagulase testing, and if positive for coagulase, consider Staphylococcus aureus. Explanation. This scenario presents a professional challenge due to the critical need to accurately identify a microbial contaminant in a pharmaceutical product. Misidentification can lead to incorrect treatment strategies, potentially harming patients, and significant regulatory repercussions for the manufacturer. The professional must exercise meticulous judgment, relying on established scientific principles and regulatory guidelines. The correct approach involves a systematic, multifaceted microbiological investigation. This includes initial macroscopic and microscopic examination, followed by appropriate culturing techniques on selective and differential media. Further biochemical testing and, crucially, molecular identification methods, such as PCR or sequencing, are essential for definitive identification. This comprehensive approach ensures accuracy, minimizes the risk of false positives or negatives, and aligns with good manufacturing practices, GMP, and relevant pharmacopoeial standards, e.g., USP/EP, which mandate rigorous quality control and product safety. Adherence to these standards is a regulatory requirement for market authorization and continued compliance. An incorrect approach would be to rely solely on initial visual inspection or a single, non-specific culture result. This fails to meet the required level of scientific rigor and regulatory compliance. Such an approach risks misidentifying the organism, leading to inappropriate corrective actions, or, worse, the release of a contaminated product. Ethically, this breaches the duty of care to patients and the public. Another incorrect approach would be to prematurely conclude identification based on limited biochemical tests without confirmatory molecular methods, especially for challenging or unusual isolates. This also falls short of the comprehensive identification required by regulatory bodies and pharmacopoeias, potentially leading to an incomplete understanding of the contamination and ineffective remediation. Professionals should employ a decision-making framework that prioritizes patient safety and regulatory compliance. This involves 1. Understanding the regulatory landscape and applicable standards. 2. Implementing a robust, validated testing protocol. 3. Critically evaluating all data generated. 4. Consulting with subject matter experts when necessary. 5. Documenting all steps and findings meticulously. 6. Taking decisive action based on confirmed results to ensure product integrity and patient well-being. Question 10. The investigation demonstrates a consistent pattern of unusual neurological symptoms in a cluster of patients presenting to your practice over the past 6 months, with no clear individual etiology identified for each case. While each patient's presentation is distinct, the recurring constellation of symptoms suggests a potential underlying systemic pathology that is not yet recognized by current diagnostic criteria. You are concerned that this could represent a novel or emerging health issue affecting a broader population. What is the most ethically and professionally responsible course of action? Option A. Continue to treat each patient individually based on their presenting symptoms, without further investigation into the observed pattern, as there is no definitive diagnosis for the cluster. Option B. Advise your patients that their symptoms are likely unrelated and due to individual lifestyle factors, and refrain from further exploration of the pattern to avoid causing unnecessary concern. Option C. Systematically document the observed pattern, consult with relevant specialists and colleagues to validate your observations, and if the suspicion of a systemic issue persists, report your findings through appropriate medical and public health channels. Option D. Immediately publish your preliminary findings in a widely accessible public forum to alert the public and encourage them to seek medical attention if they experience similar symptoms. The correct answer is C. Systematically document the observed pattern, consult with relevant specialists and colleagues to validate your observations, and if the suspicion of a systemic issue persists, report your findings through appropriate medical and public health channels. Explanation. Scenario analysis. This scenario presents a significant ethical dilemma for a physician practicing within the Federation Licensing Examination (FLEX) jurisdiction. The challenge lies in balancing the physician's duty to their patient with the potential for systemic harm if a widespread, undiagnosed condition is not addressed. The physician has identified a pattern of symptoms that, while not definitively linked to a single cause in individual cases, suggest a broader pathological process affecting a segment of the population. The ethical tension arises from the physician's obligation to maintain patient confidentiality and avoid unnecessary alarm versus the potential public health implications of remaining silent. The physician must navigate the complexities of diagnostic uncertainty, the limitations of individual patient data, and the responsibility to contribute to the broader understanding and management of disease. Correct approach analysis. The correct approach involves meticulously documenting the observed pattern, seeking consultation with colleagues and specialists, and, if the suspicion of a systemic issue persists, reporting these observations through appropriate channels within the medical community and public health infrastructure. This aligns with the ethical principles of beneficence, acting in the best interest of patients and the public, and non-maleficence, avoiding harm. It also adheres to professional guidelines that encourage physicians to contribute to medical knowledge and public health initiatives. By pursuing a systematic investigation and reporting mechanism, the physician acts responsibly to potentially identify and address a systemic pathology, thereby protecting a larger population from harm. This approach prioritizes evidence-based decision-making and collaborative problem-solving, which are cornerstones of professional medical practice. Incorrect approach is analysis. One incorrect approach would be to dismiss the observed pattern as mere coincidence or individual variations in presentation. This fails to uphold the physician's duty of vigilance and proactive engagement with potential health threats. It represents a failure of beneficence by neglecting a potential opportunity to identify and address a systemic issue that could impact many patients. Ethically, it borders on negligence by ignoring concerning trends. Another incorrect approach would be to immediately publicize the findings without proper validation or consultation. This would violate patient confidentiality, potentially cause undue public alarm, and undermine the scientific process of medical investigation. It disregards the professional responsibility to ensure that any public health pronouncements are based on robust evidence and have been vetted by peers and relevant authorities. This approach prioritizes sensationalism over responsible medical practice. A third incorrect approach would be to focus solely on treating individual patients without considering the underlying pattern. While individual patient care is paramount, ignoring a potential systemic issue means missing an opportunity to prevent future cases or mitigate the impact of the condition on a larger scale. This approach is ethically deficient as it limits the physician's beneficence to the individual patient, neglecting a broader responsibility to public health. Professional reasoning. When faced with a potential systemic pathology, a physician should employ a structured decision-making process. This begins with thorough documentation of individual cases and the observed patterns. Next, seeking peer consultation and engaging with specialists is crucial for validation and expert opinion. If the suspicion remains strong, the physician should then consider reporting mechanisms, which may involve internal hospital reviews, professional society consultations, or reporting to public health agencies, depending on the nature and severity of the suspected pathology. This systematic, evidence-based, and collaborative approach ensures that patient well-being and public health are prioritized while adhering to ethical and professional standards. Question 11. Upon reviewing a patient's medical history, a healthcare professional identifies a diagnosis of a highly contagious and reportable infectious disease. The patient expresses significant concern about the social stigma and potential professional repercussions if this diagnosis becomes known. The professional must decide on the most appropriate course of action to balance the patient's privacy with the public health mandate to prevent disease transmission. Which of the following actions best aligns with public health principles and regulatory requirements for healthcare professionals? Option A. Disclose the patient's diagnosis to their employer and social network to ensure they take necessary precautions, prioritizing community safety over individual confidentiality. Option B, immediately report the diagnosis to the local public health department as required by law, while also providing the patient with comprehensive counseling on disease management and the importance of public health measures, ensuring confidentiality is maintained within the reporting process. Option C, advise the patient to self-isolate and inform their close contacts without reporting the diagnosis to public health authorities to protect the patient's privacy and avoid potential legal obligations. Option D, focus solely on treating the patient's symptoms and educating them about personal hygiene, deferring any reporting or notification to public health authorities until the patient explicitly consents. The correct answer is B. Immediately report the diagnosis to the local public health department as required by law, while also providing the patient with comprehensive counseling on disease management and the importance of public health measures, ensuring confidentiality is maintained within the reporting process. Explanation: this scenario presents a professional challenge due to the inherent tension between individual patient autonomy and the broader public health imperative to control infectious disease. A healthcare professional must navigate this by applying principles of public health while respecting patient rights and confidentiality, as mandated by the Federation Licensing Examination (FLEX) regulatory framework. The core of the challenge lies in balancing the duty to warn or report with the duty of confidentiality. The correct approach represents best professional practice because it prioritizes a systematic, evidence-based, and legally compliant response. It involves a thorough assessment of the public health risk, consultation with appropriate public health authorities, and a clear understanding of reporting obligations under relevant public health laws and regulations. This approach ensures that actions taken are proportionate to the risk, minimize harm to both the individual and the community, and adhere to ethical and legal standards. An incorrect approach that fails to involve public health authorities would be a significant regulatory and ethical failure. It could lead to inadequate containment of a communicable disease, potentially endangering the wider community. Furthermore, it might violate specific reporting requirements outlined in public health statutes, exposing the professional to disciplinary action. Another incorrect approach, such as immediately disclosing patient information without proper assessment or legal basis, would constitute a breach of patient confidentiality, a fundamental ethical and legal obligation. This could erode patient trust and deter individuals from seeking necessary medical care. A third incorrect approach, focusing solely on individual patient education without considering the broader public health implications or reporting obligations, neglects the professional's responsibility to protect the community. Professionals should employ a decision-making framework that begins with identifying the potential public health threat. This involves assessing the nature of the illness, its transmissibility, and the severity of the potential harm. Next, they must consult relevant public health laws and guidelines to understand their specific reporting and intervention duties. This is followed by a risk-benefit analysis, weighing the potential harm to the individual e.g., breach of confidentiality against the potential harm to the public. Consultation with public health officials is crucial to ensure a coordinated and effective response. Finally, documentation of all actions and decisions is essential for accountability and legal protection. Question 12. Quality control measures reveal an unexpected positive result for a specific substance in a patient's biological sample. The initial assay used is a standard screening test. The patient presents with no immediate or obvious clinical signs directly attributable to this substance. What is the most appropriate course of action? Option A. Report the positive screening result as definitive evidence of intoxication without further investigation. Option B. Conduct confirmatory testing using a different validated methodology and consult with a toxicologist or medical professional for interpretation in the context of the patient's clinical history and potential exposures. Option C. Disregard the positive result as it is likely a false positive due to the absence of clinical symptoms. Option D. Initiate immediate treatment based on the positive screening result and inform relevant authorities. The correct answer is D. Initiate immediate treatment based on the positive screening result and inform relevant authorities. Explanation: scenario analysis. This scenario presents a professional challenge due to the potential for misinterpretation of toxicology results, which can have significant implications for patient care, legal proceedings, and public health. The ambiguity in the initial findings necessitates a rigorous and systematic approach to ensure accuracy and avoid erroneous conclusions. Professionals must exercise careful judgment to differentiate between true positives, false positives, and clinically insignificant findings, all while adhering to strict protocols. Correct approach analysis. The correct approach involves a multifaceted strategy that prioritizes confirmation and contextualization. This includes retesting, using a different validated methodology to rule out analytical error, consulting with a toxicologist or medical professional for interpretation within the patient's clinical context, and reviewing the patient's medication history and potential exposures. This comprehensive method aligns with best professional practices by ensuring the reliability of the results, providing accurate diagnostic information, and supporting evidence-based clinical decision-making. It upholds ethical obligations to provide competent care and avoid harm stemming from inaccurate information. Incorrect approaches analysis. One incorrect approach involves immediately reporting the initial positive result without further verification. This fails to account for the possibility of false positives due to laboratory error, interfering substances, or assay limitations. Such an action constitutes a regulatory and ethical failure by potentially leading to inappropriate treatment, unnecessary patient anxiety, and misdirection of investigative efforts. It violates the principle of accuracy and due diligence. Another incorrect approach is to dismiss the initial positive result solely based on the absence of overt clinical symptoms. Toxicology results, particularly in cases of chronic exposure or specific drug classes, may not always correlate directly with immediate, observable symptoms. Ignoring a potentially valid finding without proper investigation risks overlooking a serious underlying condition or exposure, which is a failure in professional responsibility and could have severe health consequences for the patient. A third incorrect approach is to rely on a single, unconfirmed positive result for definitive diagnosis or legal conclusions. This demonstrates a lack of understanding of the inherent variability and potential for error in laboratory testing. It is a regulatory and ethical failure to make critical decisions based on incomplete or unverified data, potentially leading to miscarriages of justice or improper medical interventions. Professional reasoning. Professionals should adopt a systematic decision-making process that begins with acknowledging the potential for error in any laboratory test. Upon receiving an unexpected or potentially significant toxicology result, the immediate step should be to review the laboratory's quality control data, consider the possibility of analytical interference, and plan for confirmatory testing. Crucially, the interpretation of toxicology results must always be integrated with the patient's clinical presentation, medical history, and known potential exposures. Collaboration with specialists, such as toxicologists or clinical pathologists, is essential for complex cases. This iterative process of verification, contextualization, and expert consultation ensures that decisions are based on the most accurate and relevant information available, thereby upholding professional standards and patient welfare. Question 13. Examination of the data shows a patient presenting with a palpable abdominal mass and significant weight loss. A biopsy of the mass reveals atypical cells with pleomorphic nuclei and increased mitotic activity. However, the gross description of the specimen is limited, and the patient's past medical history is incomplete. Which of the following represents the most appropriate next step in managing this patient's pathology? Option A. Request a more detailed gross description of the specimen and a comprehensive review of the patient's full clinical history to correlate with the biopsy findings. Option B. Proceed with a treatment plan based solely on the microscopic findings of atypical cells, assuming a malignant process. Option C. Focus treatment solely on managing the patient's weight loss symptoms, deferring definitive diagnosis of the mass. Option D. Inform the patient of a definitive diagnosis of malignancy based on the preliminary biopsy results, without further investigation. The correct answer is A. Request a more detailed gross description of the specimen and a comprehensive review of the patient's full clinical history to correlate with the biopsy findings. Explanation. Scenario analysis. This scenario presents a professional challenge due to the inherent complexity of interpreting pathological findings in the context of a patient's clinical presentation. Physician must integrate microscopic evidence with macroscopic observations and patient history to arrive at an accurate diagnosis and subsequent treatment plan. Misinterpretation can lead to delayed or incorrect treatment, impacting patient outcomes. The challenge lies in the nuanced nature of pathology, where subtle cellular changes can have significant clinical implications, and the need to balance diagnostic certainty with the possibility of evolving disease. Correct approach analysis. The correct approach involves a comprehensive review of all available pathological data, including gross and microscopic descriptions, alongside the patient's complete clinical picture. This holistic integration is paramount for accurate diagnosis and effective patient management. It aligns with the ethical and professional obligation to provide evidence-based care, ensuring that diagnostic conclusions are supported by all relevant information. This approach minimizes the risk of diagnostic errors and promotes optimal patient outcomes, reflecting the highest standards of medical practice. Incorrect approaches analysis. One incorrect approach is to solely rely on the initial microscopic findings without considering the gross pathology or clinical context. This fails to acknowledge that pathology is a multifaceted discipline where different levels of observation are interconnected. Ethically, this is a failure to exercise due diligence and a potential breach of the standard of care, as it ignores crucial diagnostic information. Another incorrect approach is to prioritize the patient's subjective symptoms over objective pathological findings. While patient history is vital, definitive diagnoses often hinge on objective evidence. Disregarding clear pathological indicators in favor of symptoms alone can lead to misdiagnosis and inappropriate treatment, violating the principle of beneficence and non-maleficence. A third incorrect approach is to make a definitive diagnosis based on preliminary or incomplete pathological reports without awaiting final confirmation or further specialized analysis. This demonstrates a lack of professional rigor and can result in premature clinical decisions. It is a failure to adhere to established diagnostic protocols and can expose the patient to unnecessary risks. Professional reasoning. Professionals should adopt a systematic approach to pathological interpretation. This involves 1. Thoroughly reviewing all provided pathological reports, gross and microscopic. 2. Correlating these findings with the patient's clinical history, physical examination, and other diagnostic investigations. 3. Consulting with pathology specialists if there is any ambiguity or complexity. 4. Formulating a differential diagnosis, and then narrowing it down based on the totality of evidence. 5. Communicating findings and treatment recommendations clearly to the patient and other healthcare providers. This structured decision-making process ensures that all relevant data is considered, leading to the most accurate and patient-centered care. Question 14. Performance analysis shows that a forensic pathologist is tasked with examining the body of an individual found deceased under circumstances that are not immediately clear. The pathologist has access to the body, preliminary scene photographs, and a limited medical history. The pathologist must determine the cause and manner of death. Which of the following approaches best reflects the professional and ethical obligations within the Federation Licensing Examination (FLEX) regulatory framework for this scenario? Option A. Conduct a comprehensive autopsy, meticulously documenting all findings, and then formulate a differential diagnosis for the cause and manner of death, clearly articulating the most probable conclusion based on the totality of the evidence, while ensuring all findings are communicated in an understandable manner to relevant parties. Option B. Immediately focus on the most obvious potential cause of death suggested by the scene, performing only the examination necessary to confirm that initial hypothesis, and then report those findings. Option C. Provide a detailed medical report filled with highly technical terminology, assuming that legal and law enforcement professionals will understand the nuances, and include speculative opinions about the deceased's lifestyle and potential contributing factors not directly evident from the physical examination. Option D. Perform a cursory examination, prioritizing speed over thoroughness, and provide a preliminary opinion based on the most striking but potentially misleading findings, deferring detailed analysis to a later stage if requested. The correct answer is A. Conduct a comprehensive autopsy, meticulously documenting all findings, and then formulate a differential diagnosis for the cause and manner of death, clearly articulating the most probable conclusion based on the totality of the evidence, while ensuring all findings are communicated in an understandable manner to relevant parties. Explanation. Scenario analysis. This scenario presents a professional challenge due to the inherent complexities of forensic pathology, particularly when dealing with cases that have potential legal ramifications. The pathologist must balance the scientific rigor of their examination with the need for clear, objective communication to non-medical stakeholders, such as law enforcement and legal counsel. The challenge lies in interpreting subtle findings, considering differential diagnoses, and articulating conclusions in a manner that is both scientifically sound and legally comprehensible, while adhering strictly to the Federation Licensing Examination (FLEX) regulatory framework. Correct approach analysis. The correct approach involves a thorough, systematic examination of all available evidence, including the body, medical history, and scene information. The pathologist must then formulate a differential diagnosis, considering all plausible causes of death, and clearly articulate the most likely cause based on the totality of the evidence. This approach aligns with the FLEX examination's emphasis on comprehensive understanding and application of forensic principles. It ensures that conclusions are evidence-based, minimizing the risk of misinterpretation or bias, and upholding the ethical obligation to provide accurate and unbiased expert testimony. This adheres to the principles of scientific integrity and professional responsibility expected of licensed medical professionals. Incorrect approaches analysis. One incorrect approach would be to prematurely focus on a single cause of death without considering all other possibilities. This violates the principle of thoroughness and can lead to confirmation bias, where evidence supporting the initial hypothesis is prioritized while contradictory evidence is overlooked. This is ethically problematic as it compromises the objectivity required in forensic investigations and could lead to a miscarriage of justice. Another incorrect approach would be to present findings in overly technical medical jargon without clear explanations for non-medical audiences. While scientifically accurate, this fails to meet the professional obligation to communicate effectively with legal and investigative bodies. This can lead to misunderstandings, misinterpretations of evidence, and potentially flawed legal decisions, which is a failure of professional duty. A third incorrect approach would be to speculate or offer opinions beyond the scope of the direct findings, such as attributing motive or intent. Forensic pathology is concerned with the cause and manner of death, not the psychological state or actions of individuals, unless directly inferable from physical evidence. Such speculation is outside the purview of the pathologist's expertise and can introduce inadmissible or misleading information into legal proceedings, violating professional boundaries and ethical guidelines. Professional reasoning. Professionals facing such situations should employ a structured decision-making process. This begins with a commitment to thoroughness and objectivity. They must systematically gather and analyze all relevant data. When formulating conclusions, they should consider a range of possibilities and weigh the evidence supporting each. Communication should be tailored to the audience, ensuring clarity and accuracy without sacrificing scientific integrity. Finally, professionals must recognize the limits of their expertise and avoid venturing into areas where they lack direct evidence or specialized knowledge. This systematic approach ensures that their work is both scientifically sound and ethically defensible, aligning with the rigorous standards of the FLEX examination. Question 15. Benchmark analysis indicates that a financial advisor is meeting with a client who has recently been diagnosed with a significant autoimmune disease. The client expresses concern about how this diagnosis might impact their long-term financial security and their ability to meet future healthcare costs. The advisor has a strong understanding of investment strategies and retirement planning, but limited knowledge of immunology and the specific financial implications of chronic autoimmune conditions. Which of the following represents the most appropriate course of action for the advisor? Option A. Acknowledge the client's concerns, explain the advisor's limitations in understanding the medical aspects of the disease, and recommend the client consult with a medical professional to understand the prognosis and potential healthcare needs, while also offering to work with the client to adjust their financial plan once more information is available. Option B. Advise the client that their health condition is a personal matter and should not influence their financial planning decisions, encouraging them to focus solely on traditional investment and saving strategies. Option C. Offer to research the specific autoimmune disease and its potential financial consequences, providing the client with an immediate assessment of how it might affect their financial future. Option D. Proceed with standard financial planning advice, focusing on general investment principles and retirement savings, and assure the client that their financial plan can be adjusted later if unforeseen circumstances arise. The correct answer is A. Acknowledge the client's concerns, explain the advisor's limitations in understanding the medical aspects of the disease, and recommend the client consult with a medical professional to understand the prognosis and potential healthcare needs, while also offering to work with the client to adjust their financial plan once more information is available. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a financial advisor to navigate a complex client situation involving a potential conflict of interest and a need for specialized knowledge beyond their immediate expertise. The client's health condition directly impacts their financial planning needs, necessitating a careful balance between providing appropriate advice and recognizing the boundaries of their professional competence. The advisor must act in the client's best interest while adhering to regulatory requirements regarding disclosure and suitability. Correct approach analysis. The correct approach represents best professional practice because it prioritizes the client's well-being and adheres to regulatory mandates. By acknowledging the limitations of their expertise in immunology and recommending a consultation with a qualified medical professional, the advisor is acting ethically and in accordance with the principle of know your client and suitability. This also aligns with regulatory requirements that financial advice must be suitable for the client's circumstances, which in this case are significantly influenced by their health. Furthermore, by proactively seeking to understand the implications of the client's condition on their financial goals, the advisor demonstrates a commitment to providing comprehensive and informed advice, even if it requires external consultation. This approach avoids making assumptions or providing advice that could be detrimental due to a lack of specialized knowledge. Incorrect approaches analysis. One incorrect approach involves proceeding with financial recommendations without fully understanding the client's medical condition. This is a significant regulatory and ethical failure because it violates the principle of suitability. The advisor is making recommendations without a complete picture of the client's risk tolerance, time horizon, and potential future financial needs, all of which can be profoundly affected by an autoimmune disease. This could lead to inappropriate investment choices or financial strategies that are not aligned with the client's actual circumstances, potentially causing financial harm. Another incorrect approach is to dismiss the client's concerns about their health condition as irrelevant to financial planning. This demonstrates a lack of empathy and a failure to grasp the holistic nature of financial advice. Ethically, it is unprofessional to disregard a significant factor influencing a client's life and financial decisions. From a regulatory standpoint, it shows a disregard for the Know Your Client rule, which mandates understanding all material aspects of a client's situation. A third incorrect approach is to offer speculative advice about the financial implications of the autoimmune disease without any medical basis. This is a dangerous ethical and regulatory breach, constitutes practicing outside one's scope of expertise, and could lead to the client making critical financial decisions based on misinformation. This is a violation of professional conduct and could expose the advisor to liability. Professional reasoning. Professionals should employ a decision-making framework that begins with active listening and information gathering. This involves understanding the client's stated needs and any underlying factors that may influence those needs, such as health. When a factor like a medical condition is raised, the professional must assess its potential impact on the financial plan. If the impact requires specialized knowledge outside the professional's domain, the ethical and regulatory imperative is to seek that knowledge or refer the client to a qualified expert. This ensures that advice is always suitable, informed, and in the client's best interest, while maintaining professional boundaries and adhering to all applicable regulations. Question 16. Analysis of a physician considering the use of an investigational immunopathology drug for a patient with a severe, refractory condition where standard treatments have failed. The drug has shown promising preliminary results in early-stage trials, but is not yet approved by regulatory authorities. The physician believes this drug might offer the patient a chance for significant improvement. What is the most appropriate course of action? Option A. Proceed with the investigational drug without seeking IRB approval, as the patient's condition is critical and time is of the essence. Option B. Inform the patient about the investigational drug, but advise against its use due to the lack of definitive efficacy data and potential unknown risks. Option C. Administer the investigational drug immediately to provide the patient with the best possible chance of recovery, given the severity of their condition. Option D. Obtain comprehensive informed consent from the patient, detailing the investigational nature of the drug, potential risks, benefits, and alternatives, and consult with the Institutional Review Board or Ethics Committee regarding the proposed use and appropriate documentation. The correct answer is D. Obtain comprehensive informed consent from the patient, detailing the investigational nature of the drug, potential risks, benefits, and alternatives, and consult with the Institutional Review Board or Ethics Committee regarding the proposed use and appropriate documentation. Explanation. This scenario is professionally challenging because it requires a physician to balance immediate patient needs with the ethical and regulatory obligations surrounding the use of investigational drugs. The physician must navigate the complexities of informed consent, potential risks and benefits, and the proper documentation and reporting requirements for experimental treatments, all while ensuring the patient's well-being remains paramount. Careful judgment is required to avoid premature or inappropriate use of unproven therapies. The correct approach represents best professional practice because it prioritizes patient safety and adherence to regulatory guidelines. Obtaining comprehensive informed consent, which includes a thorough explanation of the investigational nature of the drug, potential risks, benefits, and alternatives, is a fundamental ethical and legal requirement. Consulting with the Institutional Review Board or Ethics Committee ensures that the proposed use aligns with established research protocols and ethical standards, providing an additional layer of oversight. Documenting the rationale for treatment and the patient's response meticulously is crucial for ongoing patient care, potential future research, and regulatory compliance. This approach upholds the principles of beneficence, non-maleficence, and patient autonomy, while also respecting the regulatory framework governing clinical trials and investigational new drugs. An incorrect approach that involves administering the investigational drug without full informed consent would be a significant ethical and regulatory failure. This violates the principle of patient autonomy and exposes the physician to legal liability. It bypasses the essential process of ensuring the patient understands the experimental nature of the treatment and its associated uncertainties. Another incorrect approach, such as proceeding with the drug without consulting the IRB or Ethics Committee, represents a failure to adhere to institutional and regulatory protocols designed to protect research participants. This can lead to the use of unproven therapies outside of a controlled and monitored environment, potentially jeopardizing patient safety and undermining the integrity of research. It also neglects the collaborative and oversight role of these committees in ensuring ethical research conduct. A third incorrect approach, which involves delaying treatment indefinitely due to uncertainty, without exploring all available avenues for compassionate use or clinical trial participation, could be considered a failure of beneficence if a potentially beneficial treatment exists. While caution is necessary, a complete lack of action when appropriate pathways exist can be detrimental to the patient's health. The professional decision-making process for similar situations should involve a systematic evaluation of the patient's condition, available treatment options, including standard care, clinical trials, and compassionate use programs, and the potential risks and benefits of each. A thorough understanding of relevant regulations, institutional policies, and ethical principles is essential. Open and honest communication with the patient and their family, ensuring comprehensive informed consent, and seeking appropriate expert consultation and oversight, e.g., from an IRB or ethics committee, are critical steps in making responsible and ethical treatment decisions. Question 17. Quality control measures reveal that a healthcare professional is managing a patient concurrently prescribed warfarin and several over-the-counter supplements. The professional needs to assess potential drug interactions. Which of the following approaches best aligns with the regulatory framework and ethical guidelines for the Federation Licensing Examination, FLEX? Option A. Extrapolating potential interactions based on the known mechanisms of action of warfarin and the general pharmacological properties of the supplements, without consulting specific interaction data. Option B. Consulting a comprehensive, peer-reviewed drug interaction database that is regularly updated and specifically references interactions with warfarin and common herbal supplements. Option C. Reviewing information from the websites of supplement manufacturers, assuming their claims about safety are accurate and comprehensive. Option D. Relying on personal experience and informal discussions with colleagues about potential interactions with warfarin and supplements. The correct answer is B. Consulting a comprehensive, peer-reviewed drug interaction database that is regularly updated and specifically references interactions with warfarin and common herbal supplements. Explanation. This scenario presents a professional challenge due to the inherent complexity of drug interactions and the critical need for accurate, up-to-date information to ensure patient safety. Professionals must navigate a constantly evolving landscape of pharmacological knowledge, where new interactions are identified and existing ones are better understood. The challenge lies in discerning reliable information from less credible sources and applying that knowledge effectively within the scope of their practice, adhering strictly to the Federation Licensing Examination (FLEX) regulatory framework. The correct approach represents best professional practice because it prioritizes patient well-being through a systematic and evidence-based method of identifying and managing drug interactions. This involves consulting authoritative, peer-reviewed resources and professional guidelines that are recognized within the FLEX jurisdiction. Such resources are typically updated regularly and reflect the consensus of experts, minimizing the risk of misinformation. Adhering to these standards ensures that decisions are grounded in the most current and reliable scientific evidence, fulfilling the ethical obligation to provide competent care and complying with the FLEX examination's emphasis on evidence-based practice. An incorrect approach that relies on anecdotal evidence or outdated information represents a significant regulatory and ethical failure. Anecdotal evidence, while sometimes a starting point for further investigation, is not a substitute for rigorous scientific validation and can lead to incorrect assumptions about drug interactions. Using outdated information is equally problematic, as it can result in overlooking newly discovered interactions or misjudging the severity of known ones, potentially leading to adverse drug events. Both practices violate the fundamental ethical duty of care and the regulatory requirement to practice within the bounds of current knowledge and accepted standards, as assessed by the FLEX. Another incorrect approach might involve extrapolating information from similar but distinct drug classes without direct evidence of interaction. While understanding drug mechanisms can inform hypotheses, making clinical decisions based solely on such extrapolation without specific data is speculative and risky. This bypasses the due diligence required by regulatory bodies and ethical practice, which mandates reliance on established evidence for patient care decisions. The professional decision-making process for similar situations should involve a structured approach. 1. Identify the potential for drug interactions based on the patient's medication regimen. 2. Consult primary, authoritative, and peer-reviewed drug interaction databases and literature recognized within the FLEX jurisdiction. 3. Evaluate the strength of the evidence for any identified interaction, considering its clinical significance and potential patient impact. 4. If uncertainty exists, seek consultation with a pharmacist, physician, or other qualified healthcare professional. 5. Document all findings, decisions, and actions taken regarding drug interactions. 6. Continuously update knowledge on drug interactions through ongoing professional development. Question 18. Benchmark analysis indicates that a patient presents with a constellation of symptoms suggestive of a serious underlying condition, but the exact diagnosis remains unclear. The physician must determine the most appropriate diagnostic pathway. Which of the following approaches best reflects a comprehensive risk assessment in this clinical scenario? Option A. Prioritize less invasive diagnostic tests that offer a high probability of yielding crucial information, while carefully considering the potential for false negatives and the need for subsequent, potentially more invasive, investigations if initial results are inconclusive. Option B. Defer diagnostic investigations until the patient's symptoms naturally resolve or become more pronounced, to avoid potentially unnecessary or burdensome procedures. Option C. Select diagnostic tests based primarily on the physician's personal familiarity and comfort level with specific methodologies, without extensive consideration of the patient's specific risk profile or alternative options. Option D. Immediately proceed with the most definitive and invasive diagnostic procedure available, assuming that obtaining the most precise information quickly is paramount, regardless of the associated risks. The correct answer is A. Prioritize less invasive diagnostic tests that offer a high probability of yielding crucial information, while carefully considering the potential for false negatives and the need for subsequent, potentially more invasive, investigations if initial results are inconclusive. Explanation: this scenario is professionally challenging because it requires the physician to balance the immediate need for diagnostic information with the patient's autonomy and the potential for harm from invasive procedures. The physician must conduct a thorough risk assessment, considering the patient's condition, the diagnostic yield of different approaches, and the potential complications associated with each. The correct approach represents best professional practice because it prioritizes patient safety and informed consent by thoroughly evaluating the risks and benefits of each diagnostic option and involving the patient in the decision-making process. The physician upholds ethical principles of beneficence, non-maleficence, and respect for autonomy. This aligns with the Federation licensing examination, FLEX, emphasis on patient-centered care and evidence-based practice, ensuring that diagnostic interventions are both medically appropriate and ethically sound. An incorrect approach that involves proceeding with the most invasive diagnostic test without fully exploring less invasive options fails to adequately assess risk and may violate the principle of non-maleficence if the risks outweigh the potential benefits or if less harmful alternatives exist. This could also constitute a breach of informed consent if the patient is not fully apprised of all available options and their associated risks. Another incorrect approach, such as delaying necessary diagnostic investigation due to an overestimation of minor risks, could violate the principle of beneficence by prolonging the patient's suffering or allowing a condition to progress unnecessarily. This demonstrates a failure in clinical judgment and risk assessment. Finally, an approach that relies solely on the physician's preference without considering the patient's values, preferences, or understanding of their condition would be ethically deficient, neglecting the crucial element of shared decision-making. The professional decision-making process for similar situations should involve a systematic approach. First, clearly define the clinical question and the diagnostic information needed. Second, identify all potential diagnostic options, ranging from least to most invasive. Third, for each option, meticulously assess the potential benefits, diagnostic yield, impact on treatment, and risks, complications, discomfort, cost. Fourth, consider the patient's individual factors, including their overall health status, comorbidities, personal values, and understanding of the situation. Fifth, engage in a shared decision-making conversation with the patient, explaining the risks, benefits, and alternatives in clear, understandable language. Finally, document the decision-making process and the rationale for the chosen diagnostic approach. Question 19. Research into a novel immunomodulatory pathway has yielded preliminary findings suggesting a strong correlation between its activity and the progression of a specific autoimmune disease. The research is published in a peer-reviewed journal, but acknowledges limitations in sample size and the need for further validation in diverse populations. A clinician is considering incorporating this pathway's modulation into their treatment protocols for patients with this disease. Which of the following represents the most appropriate risk assessment approach for this clinician? Option A. Prioritize the adoption of the novel immunomodulatory pathway modulation based on the publication in a peer-reviewed journal, assuming the peer review process guarantees the robustness of the findings. Option B. Critically evaluate the study's methodology, statistical rigor, and potential confounding factors. Consult with immunological experts and await further independent validation before considering any changes to patient care. Option C. Immediately adopt the novel immunomodulatory pathway modulation into treatment protocols, given the promising preliminary findings and the potential to offer a new therapeutic option. Option D. Dismiss the research findings due to the acknowledged limitations, assuming that preliminary data is unlikely to translate into effective clinical practice. The correct answer is B. Critically evaluate the study's methodology, statistical rigor, and potential confounding factors. Consult with immunological experts and await further independent validation before considering any changes to patient care. Explanation: this scenario presents a professional challenge due to the inherent uncertainty in interpreting complex immunological research findings and their potential implications for patient care or public health policy. A professional must exercise careful judgment to distinguish between preliminary, correlational data and robust, causal evidence that warrants action or significant resource allocation. The Federation Licensing Examination, FLEX, emphasizes the application of scientific knowledge within a regulatory and ethical framework, requiring professionals to assess the reliability and relevance of research before making decisions. The correct approach represents best professional practice because it prioritizes a thorough, critical evaluation of the research methodology, statistical significance, and the potential for confounding factors. This aligns with the ethical obligation to act in the best interest of patients or the public by avoiding premature conclusions based on incomplete or potentially flawed data. Regulatory frameworks, such as those governing medical practice and research ethics, mandate evidence-based decision-making and a cautious approach to adopting new findings. This involves consulting with peers, seeking independent verification, and considering the broader context of existing scientific knowledge. An incorrect approach that relies solely on the novelty or sensationalism of a research finding, without rigorous scrutiny, represents a significant regulatory and ethical failure. This could lead to the implementation of ineffective or even harmful interventions, misallocation of resources, and a breach of trust with the public. Similarly, dismissing well-conducted research due to personal bias or a lack of understanding of immunological principles is also professionally unacceptable, as it hinders scientific progress and potentially overlooks crucial advancements. Ignoring the need for peer review and independent validation violates established scientific and ethical norms, increasing the risk of propagating misinformation. Professional reasoning process for similar situations should involve a systematic approach. First, understanding the research question and methodology. Second, critically evaluating the data and statistical analysis. Third, considering the limitations and potential biases of the study. Fourth, seeking consensus or diverse expert opinions. And fifth, assessing the practical implications and potential risks and benefits before drawing conclusions or recommending action. This iterative process ensures that decisions are grounded in sound scientific evidence and ethical consideration. Question 20. System analysis indicates that a competent adult patient with a severe respiratory condition is refusing a life-sustaining intervention that would significantly improve their oxygenation, but would also place a moderate strain on their cardiovascular system. The physician understands the intricate physiological interplay between the respiratory and cardiovascular systems and the potential for decompensation in either system if the other is compromised. The physician must decide how to proceed, balancing the patient's right to refuse treatment with the duty to preserve life and well-being. Which of the following approaches best aligns with the regulatory framework and ethical guidelines governing medical practice for the Federation Licensing Examination, FLEX? Option A. Thoroughly explain to the patient the specific physiological consequences of their refusal on both their respiratory and cardiovascular systems, detailing the potential risks and benefits of the intervention, and then respect their informed decision. Option B. Inform the patient that the intervention is medically necessary and proceed with it, assuming their refusal is due to a lack of understanding of the severity of their respiratory illness. Option C. Proceed with the life-sustaining intervention against the patient's wishes, citing the immediate physiological risks to their respiratory system as paramount. Option D. Provide a brief overview of the intervention's purpose for the respiratory system, and then implement it, without delving into the cardiovascular implications or confirming the patient's full comprehension. The correct answer is A. Thoroughly explain to the patient the specific physiological consequences of their refusal on both their respiratory and cardiovascular systems, detailing the potential risks and benefits of the intervention, and then respect their informed decision. Explanation. Scenario analysis. This scenario presents a professional challenge because it requires the physician to integrate complex physiological understanding of organ system interactions with ethical considerations regarding patient autonomy and informed consent, all within the strict confines of the Federation Licensing Examination, FLEX, regulatory framework. The physician must not only possess knowledge of how the respiratory and cardiovascular systems are interdependent, but also apply this knowledge to a patient's decision-making process, ensuring the patient fully comprehends the implications of their choices. The challenge lies in translating intricate physiological concepts into understandable terms for a layperson, while respecting their right to refuse treatment, even if that refusal appears physiologically detrimental. Correct approach analysis. The correct approach represents best professional practice because it prioritizes patient autonomy and informed consent, which are fundamental ethical and regulatory tenets. By thoroughly explaining the physiological consequences of the patient decision on both the respiratory and cardiovascular systems, the physician ensures the patient can make a truly informed choice. This aligns with FLEX guidelines that emphasize the physician's duty to educate patients about their condition and treatment options, enabling them to exercise their right to self-determination. This approach respects the patient's right to refuse treatment, even if it leads to adverse physiological outcomes, as long as the patient is competent and fully informed. Incorrect approach is analysis. One incorrect approach involves proceeding with the patient's stated preference without a comprehensive explanation of the physiological ramifications. This fails to meet the standard of informed consent, as the patient may not fully grasp the severity of the consequences for their respiratory and cardiovascular health. This constitutes a regulatory and ethical failure by not adequately educating the patient, potentially leading to a decision made under duress or misunderstanding. Another incorrect approach is to override the patient's wishes based solely on the physician's assessment of physiological risk, without exploring the patient's values, goals, or understanding. This infringes upon the patient's right to autonomy and can be construed as paternalistic, which is contrary to modern medical ethics and FLEX expectations for patient-centered care. Such an approach neglects the ethical imperative to respect a competent patient's decision-making capacity. A third incorrect approach might involve using overly technical jargon or complex physiological diagrams that the patient cannot comprehend. While the intention might be to inform, the execution fails to achieve true understanding, rendering the consent process invalid. This is a failure in communication, a critical component of both ethical practice and regulatory compliance, as it does not facilitate genuine informed consent. Professional reasoning. Professionals facing similar situations should employ a decision-making framework that begins with assessing patient capacity. If capacity is confirmed, the next step is to engage in a clear, empathetic, and comprehensive dialogue. This involves explaining the physiological processes involved, the potential consequences of different choices, and the available alternatives in a manner tailored to the patient's level of understanding. The physician must actively solicit the patient's questions and concerns, ensuring their decision is based on a genuine understanding of the risks, benefits, and alternatives. This process respects patient autonomy while fulfilling the physician's duty of care and adhering to regulatory requirements for informed consent.